Conservative Democratic Congressman Bart Stupak has apparently grown nostalgic for those days late last year when he was trying to turn the health reform debate into an abortion debate, threatening to kill health reform if it wasn't used to restrict abortion rights. And, incidentally, getting a lot of attention for his efforts. Today, just as his party seems to be making progress on the issue of health reform, the otherwise little-known Michigan congressman has revived his plan to try to hijack health reform and use it as a way to essentially ban abortion, to make it essentially inaccessible for American women, who do, incidentally, have a constitutional right to have this procedure. In a statement released today, Mr. Stupak had this to say about President Obama's proposal for merging the House and Senate reform bills. He said, quote, "Unfortunately, the president's proposal encompasses the Senate language allowing public funding of abortion. The Senate language is a significant departure from current law and is unacceptable. While the president has laid out a health care proposal that brings us closer to resolving our differences, there's still work to be done before Congress can pass comprehensive health reform." And by work to be done, he means more work to make health care ban abortion. In reality, the Senate bill does not allow public funding for abortion. It specifically prohibits it, in fact. It stipulates that anyone who's getting a subsidy to help them buy insurance on the proposed exchange system has to write two separate premium checks, one to pay for their government-subsidized coverage and a separate one to pay for abortion coverage. That is emphatically, ridiculously not allowing public funding for abortion. It is, in fact, such a cumbersome, weird, intrusive new rule that it represents a new restriction on access to abortion in this country. But that's not stopping Congressman Stupak. The House abortion language, the language that was put in by Mr. Stupak himself, says that anyone who gets a subsidy to help them buy health insurance from the exchange, anyone, would be banned from buying any kind of plan that covers abortion, even if they use their own money to do so. So if you're a woman getting a subsidy for health insurance, which will be a huge proportion of the American population, it means no abortion coverage for you, even if you want to pay for it yourself. It also means that insurance companies that want to be part of the exchange, i.e. where the customers are, insurance companies in all likelihood will not cover abortions anymore. So if Democrats let Bart Stupak get his way, health reform will be hijacked to become a vehicle to all but ban abortion in this country by making it something that insurance just doesn't cover anymore in America. Abortion rights only for women rich enough to pay for it out of pocket. Joining us now is Congresswoman Jan Schakowsky, Democrat of Illinois. Congresswoman Schakowsky, thanks very much for coming on the show tonight.
Thanks, Rachel.
I know you've said that you had worked closely with conservatives in the House to make sure that the House bill didn't provide any federal funding for abortion, but you found out that that wasn't enough. Conservative Democrats like Congressman Stupak wanted new restrictions on abortion. How has this fight evolved in the House?
Well, early on, the pro-choice caucus, which is over 100 and some members in the House, realized that we will accept the status quo as the rules around abortion. In other words, that except for rape, incest, or life of the mother, that no public dollars would be used for health care. That was called the Hyde Amendment, and we were agreeing that in the new configuration with the health care exchanges that we would maintain that. And we devised language that passed the House committee that did exactly that. It was at the last minute that Bart Stupak lined up enough of Democrats and Republicans by saying that his amendment really was the status quo, and as you so clearly explained, it was not at all. That this went way past the current law, and I think that there were enough Democrats who believed that that was true, that it was the status quo, that they voted for it. That doesn't exist anymore, and I don't see on the verge of passing health care that we're going to see now a lot of members, enough members, willing to go back to the Stupak language to defeat the whole bill. Because that's what would happen. Because the pro-choice members, 42 of us who signed a letter who said that we want to maintain the status quo, will not vote for it if it has the Stupak language. And the taste for passage of this bill right now is just too great to let it be defeated by this.
So just to be clear, you and those 40-some-odd other members of the House, when you said last year that you would not only work to keep this language out of the final bill, but that if it was still included in the final bill, that you would vote no. You stand by that. If the Stupak language is in the final House-Senate compromise bill, you will vote against it.
absolutely true, and I think that that is the understanding of those who are working on the final product of the legislation, that it's not going to pass if it has the Stupak language in it. Now, you also mentioned the Nelson language, and that was in the Senate bill and now remains in the President's proposal, and we're very concerned about that as well, and hopefully we're going to find a process to change that, because, you know, we tried this two-check deal in the past. In 2002, there was the Trade Act that allowed for 65% government support for some insurance for displaced workers. The insurance companies flatly said, we will not take two checks. And so what happened is that the worker had to send 35% to the IRS, then 100% was sent by the IRS to the insurance companies. Very complicated, but that was the only way that it would work, because the insurance companies said no to two checks. We believe that they will say no to two checks to cover abortion and the rest of health care services too. So we're very worried that it will, in effect, keep women from having access to abortions.
I feel like it's one thing to have a fight about abortion rights in this country. It's another thing to have a fight about health reform. But to try to make the twain meet and try to fight the abortion battles through health reform is turning out to be both a political and practical disaster. That is my opinion on it. I do want to ask you about one other subject today on which you are making big news today, a proposal of yours to stop private contractors from doing work that military personnel used to do. This is a big deal proposal. This would dramatically change the way that things have shifted in military affairs in this country over the past 8 years. What's the impetus for this bill from you?
Well, we have companies like Blackwater, but not only Blackwater, that are actually putting our own troops in danger, ruining the reputation of our country, murdering people, and still getting taxpayer dollars to be contractors, private military contractors, hired guns, mercenaries in our wars in Iraq and Afghanistan and actually other places around the world. What this says is that no private company will be able to do these sensitive missions any longer, that we're going to phase them out. That would include training programs for the Afghan police, for example, that Blackwater seems to be at the head of the line to get over $1 billion contract. This is a repeat offender. This is a company who has really imperiled our mission in numerous occasions and should not be allowed to do anything. So we've introduced a bill, Bernie Sanders and I, we have 17 co-sponsors in the House, to phase out the use of these private contractors. And I'm actually soliciting, Rachel, citizen supporters for my proposal at janschakowsky.org. Hope people will go there, sign my petition to show that we need to take control of our military and not have these mercenaries running these wars. Seems that we can't do without them anymore, and I think that's a very dangerous situation for our own national security.
Congresswoman Jan Schakowsky, Democrat of Illinois, thank you very much for joining us tonight and for making news on a number of subjects. Really appreciate it.
Thank you, Rachel.